This is what I see.
This is what I see.
This is what I see.
But I can't see a dentist.
It's true. Hundreds of thousands of Kansans can't see a dentist. That's because we have a serious shortage of dentists in our state. Over time, our population has shifted from rural communities to more urban areas. And as our population shifts, so does our workforce. Many rural communities across the state have lost their grocery stores, lost their retail shops. They've lost their dentists too.
The further away you get from Wichita, the more sparse our dental care gets.
Unfortunately, right now, one of the biggest gaps we have is in oral health care, is in just general practice dentists.
This isn't an isolated problem. In fact, 93 Kansas counties no longer have enough dentists. 13 of those counties have no dentists at all.
I think the biggest issue is access, especially in western Kansas, because you have providers here, but the providers that you have are limited. You also have an aging population of healthcare professionals and dental professionals, and so those two things impact the workforce greatly.
Well, a typical dentist, one dentist can treat probably 10 to 12 patients per day comfortably, solving their needs. So if you've got a 700 patient waiting list, you're booked out so far in advance, 3, 4, 5 months, that you're not addressing the chief complaint of these patients.
It's just that way in every county. There's just not enough dentists to serve the population.
Our shortage of dentists is worsened by a number of factors. Aging is one of them. The average dentist in Kansas is approaching retirement age, with no plans for another dentist to take over their practice.
I'm concerned about our area. Our county did not have a dentist up until last year when we opened, and it had been approximately 10 years since they'd had one in the county.
We know that our dentist population, our medical doctor population is aging. In 10 years, we're facing a serious crisis. You can't underestimate that crisis.
Like most states, Kansas has struggled to convince more dentists to practice in rural areas. Loan repayment programs and other incentives have helped, but the shortage of dentists persists. Today, 63% of Kansas dentists practice only in urban areas, leaving very few dentists to cover the rural communities.
With the state loan repayment options and things to get financial aid paid for, that does help us significantly, because they can get their regular salary plus $30,000 a year for student loan repayment, which is significant. I have interviewed in the last 4 months 6 different applicants, and I was fortunate enough to have 2 that wanted to come there. However, they both have said it's just for student loan repayment, and then they plan on going back to their homes, which is Omaha, and one's New York.
What we ran into in southeast Kansas was when it came time for dentists to retire in this area, then they weren't able to find practitioners that were willing to purchase their practices, or even find practitioners they could even give the practice to take over.
Trying to recruit new dentists or medical providers into the area is very challenging.
Another challenge for Kansans is the fact that most dentists do not accept patients without private dental insurance. Almost 90% of medical doctors in Kansas serve patients on Medicaid, but only 25% of dentists do the same. Additionally, The dentists that do accept Medicaid tend to accept only a handful of low-income patients.
What we do is we take care of all those patients on Medicaid that a lot of private dentists don't choose not to take care of, mainly because they only have so many slots, and they only have, they have overhead and they have people to pay. You know, it's a business decision. You can't blame a businessman for making a business decision.
On the dental side of things, it's substantially different than the medical side because dental, for many people and even middle-class people, don't have dental insurance.
If you have insurance and have means to pay for dental work financially yourself, you're still looking at 1 to 3 month wait to get into a dentist.
We're very spread out. So if patients need dental services and they need to come to us, then they're going to have to drive a ways.
Not only are you driving to find a dentist that's taking new patients, because a lot of dentists aren't even taking new patients, you're missing half a day of work, you're pulling your kids out of half a day of school, and you're driving back. So it's not just a trip to a dentist, it includes much more.
When you look beyond that, especially southeast Kansas, western Kansas, up in the northern areas, patients may have to drive 3 or 4 hours to see a dentist, and that is a problem. We would definitely have access to care issues in those areas. There may be a dentist in some of these areas, and what we find out is we still have an access to care issue because he may not be a Medicaid provider.
We see patients in the dental clinic who come from 2 and 2.5 hours away to get care. What are they doing at home for medical care? I don't know. Probably not getting it.
Charity efforts, like the annual Mission of Mercy project, have provided short-term relief for some Kansans in need of dental care. But the shortage of dentists in our state, compounded by recruitment challenges in rural areas and an aging population, call for a long-term solution.
In 2004, Pittsburg, Kansas was the hosting site for the Kansas Mission of Mercy, and I served as chairman of that event. And what it really did was brought a lot of attention to what a big problem that we have here in southeast Kansas.
I love the Missions of Mercy. I think they're fantastic. I've volunteered at them. They've been great motivators for communities. In a Mission of Mercy, you can take care of about 2,000 people. So how many Missions of Mercy would you have to do to take care of all the patients in Kansas? I'd like to do that math. You probably need to do about 100.
We donated our time here at the office and supplied and started the Westinghouse Dental Clinic, which was in a closet. It was a 9x6 room. We bought a dental chair, a little compressor, and a vacuum system. And my wife and I would go down there one night a week and see patients. And this started in 2002. And in about 6 months, we had a 785 patient waiting list. So we knew we had a severe problem, that there was no way that one night a week was going to solve the issue.
All you have to do is look at the numbers. There is no way that we can take care of all the people that need us. No way. I have 6 dentists and 9 hygienists. I could use double of both, and I would still have more work to do. It's not about dentists not doing their job. It's not about them not caring about access to care, because they do. I work with them all the time. They do care. They just don't have enough capacity.
The real problem is even yet to come.
Rural Kansas is facing an impending crisis, and that means people with health insurance, people with all the money in the world, aren't going to get into the doctor because there aren't going to be any doctors. And at some point people have to get scared about that, and we have to do something.